Now, what can the baby do to alter their thermal environment? If you look at this slide, adults actually have a lot more ammunition to change their metabolic rate and their environment than babies do. And actually, as you'll see, term infants have a few more things to do than preterm infants. So if you look at this, in this slide, for an adult, there's lots of voluntary muscle activity we can do when we're cold. We can, bundle, try to bundle ourselves up, have a change in posture, get restless or jumping around. You know what you do when you're cold. The babies can do some of that, but they have obviously limitations. They're not quite as talented at jumping around and getting themselves warm as we, the adult, are. There are some involuntary muscle activity and vasoconstriction that do occur in babies as in adults, but adults can shiver and they can have goosebumps, and babies can't have that. So there's some limitation there, again, for the infant, which sets them up to some challenges. There is some non-shivering thermogenesis, in other words, ways of making heat that are not related to shivering, and some are present in adults and babies, and in this case, brown fat metabolism, particularly in term infants, exists that doesn't exist in us, and we'll talk a little bit about that. But our cells will respond to cold by generating more energy, and that increases our ability to handle cold. Babies could do that to some degree. They're not as talented as we are in that area, but they can increase their metabolic rate in response to cold. The non-shivering thermogenesis, so this is how's our body react to cold, is different in babies and adults, but particularly in the term babies, they have something called brown fat, which allows them to generate heat. This is fat located in certain regions of the body that will increase its metabolic production and blood flow in response to cold. That goes away as babies age. But it can be very effective in term babies to allow them to handle the thermal stress. So here's a cartoon of a baby and shows some of the location of this brown fat, which, as I said, goes away as the baby matures. Certainly adults have very little of this, and preterm infants will have very little of this as well. So this is a very nice system built for term babies, but it's not really available to the rest of us.